Okay. Hi, everybody, and welcome. My name is Marie Considine. I'm the Executive Director with NAMI Westchester, and I'm really excited that you're all here tonight to join us because this is a really important event that we hold every year, our big advocacy event. Usually we hold it in person. I'm thrilled that we have Zoom and we're able to continue doing our good work together in this way. So I'm going to be sharing my screen. We do have a PowerPoint to show you tonight. So I will just get started with that. Okay, good. So welcome to our Advocacy Town Hall. I'll be your host tonight, and our speakers will be Michael Orth, the Commissioner of Westchester County Department of Community Mental Health. We also have Matthew Shapiro, Associate Director of Public Affairs for NAMI New York State. And we have some advocates who will be sharing their stories. Julie LeClaire-Neshes, who's the co-chair of the NAMI Westchester Advocacy Committee and a board member, as well as Martin Gromulat, also co-chair of NAMI Westchester Advocacy Committee and a board member as well. So the mission of NAMI Westchester is this. NAMI Westchester is an affiliate of the National Alliance on Mental Illness. We're a grassroots organization dedicated to improving the quality of life for all individuals and families whose lives are affected by mental illness and co-occurring disorders. NAMI advocates for access to services, treatment, support, and research, and is steadfast in its commitment to raise awareness and build a community of hope for all those in need. We offer the kind of understanding and care that only those who have lived the experience of mental illness can provide. We educate, support, and advocate. As I mentioned, one of the most important things we do is advocate. So our goals around advocacy are to advocate at the county, state, and national levels for non-discriminatory access to quality health care, housing, education, and employment for people with mental illness. We educate the public about mental illness. We work to eliminate the stigma of mental illness, and we advocate for increased funding for research into the causes and treatment of mental illness. Now, you'll notice that our mission and goals use the term mental illness quite a bit. When I speak, and when many people speak, we say mental health. We understand that mental health is part of overall physical health. So the language has changed, but sometimes some things in writing haven't caught up, but just wanted to let you know that. So tonight I'm going to welcome Michael Orth, our Commissioner of Westchester County Department of Community Mental Health.
Well, good evening, everyone. And Marie, thank you so much for inviting me. It's always such a pleasure. This is one of the most exciting and important events, I think, of the year. And it's always such an honor to present with Matthew Shapiro, who truly does such a wonderful job. And my role is really just to give a little bit of an overview of Westchester County. But I do want to stress the importance of and the effectiveness of advocacy and hearing folks who have lived experience or family members. And that includes at the state level, but also at a very local and county level as well. Having worked in government now for 28 years, I see how a strong voice and you guys being heard, how critical that is, especially in a time of great need and many challenges. So I'm going to just do a brief presentation, then we're going to allow Matthew to talk more about your voice and how to best advocate. So if you can turn the slide, Marie. I always just want to thank NAMI Westchester. I truly think we have the best NAMI organization around. And I just took a couple of pictures of how effective NAMI Westchester is and all the different ways we partner, including the walk, including suicide prevention efforts, awareness events. More recently, we've been doing some police work and some suicide prevention major initiatives, and NAMI is always right next to us, as you can see in the picture. So thank you, Marie. Thank you to the board and staff. We truly, truly value our partnership and hope many more years to have a successful partnership. So the next slide, I'm just going to talk briefly about some of Westchester's priorities. And just a reminder, the role of our government, Department of Community Mental Health, we're a branch of county government that under New York State mental hygiene law, we have responsibility for planning in Westchester for mental health, substance misuse, and developmental intellectual disabilities. And of course, that also includes co-occurring issues and addressing issues that are more complex. We do this in partnership with our state organizations, our local providers, other county departments. And as a county department, we have over 52 agencies we contract with and over 220 different services. And I just outlined, I'm sure Matthew's going to spend a lot more time talking about these issues, and more importantly, the state budget and the importance of really hearing what our priorities are. Workforce is probably on the top, as you'll hear. We have a understaffed, underpaid, undervalued workforce, and that includes clinicians, peers, across the board. And I know Matthew will talk about some of the hopeful proposals in the state budget, but it just can't be one-shot gimmicks. We also have to have ongoing, long-term, sustainable commitment to the workforce. Fortunately, we're seeing, unfortunately because of the pandemic, but fortunately we're seeing a lot of money come our way. But in the absence of trained, qualified workforce, the resources, to be honest with you, are useless. So that's probably our number one area of focus across the board is workforce. As Maria alluded to, I think it's so important that we talk about mental wellness for all of our residents. We obviously have seen an increase in our residents reaching out for mental health services. So part of that is educating them, letting them know about the resources, and also how they can help themselves, family members, and loved ones. So we've been doing a lot of work through commercials, advertisement, trainings, and obviously in partnership with NAMI to really build awareness and engagement. The other area that's unfortunately been under a lot of stress is our outpatient clinics and capacity. We definitely have massive waiting lists. So one of our advocacy points is really to support our agencies to build capacities. We're also working closely with private therapists. Because of the pandemic, obviously, many people never even looked at their commercial insurance plan outside of physical health. And then with the pandemic and the great needs, we're seeing our private panels being stretched. Many of them may be great clinicians, but don't know the resources available, whether it's NAMI or peer support. So we're really spending a lot of time trying to educate folks in private therapists to learn about what's out there. Obviously, you've heard this before about co-occurring services, and unfortunately at the state level, we still sort of operate in silos, but we know locally when the rubber hits the road that we need a true integrated and competent system of care where regardless of which door you walk through, you will get competent services that can address both the mental health and substance misuse issues. You'll hear a little bit more later about what we're doing to really address that issue, to build evidence-based practices, whether it's the mental health system or the substance use system. And I think we're leading the way, not only in the state, but across the country in creating what we call a co-occurring system of care. The other area we'll talk a little bit about, and I know Matthew's going to share a lot about this, is behavioral health crisis services. And whether it's police response, whether it's a psychiatric response, we've done a lot of work in this area in New York State, but also locally that I'm going to share about. Obviously, we're still struggling with the overdose issue within Westchester and across the country. And then one of the areas that is a major focus is children's mental health services. So if you can move to the next slide, one of the things that we're really focused on is not just, if you can move the slide, Marie.
I'm trying. I don't know what happened.
Oh, I'm sorry.
Kind of frozen.
We're frozen.
There we go.
There we go. You know, this is a real major focus of Westchester County, and I'm sure across the state, is it bringing the service to where individuals are at, and not just office-based or hospital-based. So these are some examples of where we're co-locating mental health, behavioral health services within some of these areas. And whether it's mobile mental health, whether it's providing mental health services in school-based satellites. We actually have a monthly meeting with all the colleges, 13 in Westchester, that we're looking at how do we support wellness and mental health services and provide easier access for college students in mental health. We're also doing a lot of integrated mental health and physical health. We are also in Westchester doing a lot of police outreach, homeless outreach, and also more recently providing evidence-based practices, including medication-assisted treatment in state prison and county jail. And I'm sure Matthew will talk a little bit about some major investments at the state level so counties can provide these services within the county jail. And this is something it's fairly new, and we received a pretty significant amount of funding to provide co-occurring services, mental health treatment, and substance misuse treatment within our county jail. The next slide talks about it's not just throwing money at the problem or at the issues, but really having effective treatments that will lead to good outcomes. And I put on the screen a few of the areas and few of the practices that have evidence base that we know are effective in supporting our children and adults. There's been a lot more focus on motivational interviewing as a way of engaging people into treatment. In the co-occurring world, I think we're one of the first counties in New York State to use an evidence-based treatment program called Encompass for adolescents and young adults. And there's also a part of that called CRAFT, where we work with the person's family members or loved one to support them as their family members struggling with substance misuse and mental health issues. We, as a county, I think effectively use our ACT teams. And for those of you who don't know ACT teams, they're sort of mobile, multidisciplinary teams that work with individuals who have complex issues, and they're community-based. And they also involve peers, clinicians, and other important areas to help support the person's plan. We're doing a lot of work on trauma-informed care and also diversion from courts. Thanks to our fairly new district attorney, Mimi Roca, she's worked closely with us to try to prevent people who may have had a lower level offense, maybe they were struggling with a mental health issue, and rather than have it on their record, offer a diversion that includes motivational interviewing, that they work with our staff at DCMH, and give them a new opportunity, help them look at some of their decisions and address some of their mental health issues. So this is a new program called Fresh Start that we're rolling out in all of our courts throughout Westchester County. And the other thing I did not include in this slide, but we all know needs to be integrated in all the different programs, is really peer, family, youth support. We know the effectiveness of having someone with lived experience in terms of engagement, ongoing support, and working in a multidisciplinary fashion. So all of the programs that we're implementing, we'll talk about a few of them moving forward, really involves having peers included in a support team. The next slide, which again, I know Matthew will talk about, but obviously the pandemic has impacted everyone. We're really seeing the ripple effect on our children and adolescents. And one of the things that we're trying to promote for all young people, and for adults to be quite frank, is what we call the pillars of trauma-informed care, that every human being, including children, are trying to strive for a sense of safety, a sense of connectedness, and helping them to self-regulate and coping. And we can do that in schools, in our community-based programs, within our families, and trying to give young people those sense of connectedness, feeling safe, and also helping them cope, whether it's through therapy, mindfulness, exercise, or whatever helps them to self-regulate and cope during some challenging times. So we're doing this, and we hope that the advocacy will be around school-based mental health services, trying to provide those services where the young people are at, really looking at respite and crisis services to avert unnecessarily hospitalizations or other extreme interventions. We're big fans of mental health first aid. And this year we rolled out what's called teen mental health first aid, which is really providing sort of the CPR of mental health to young people. And we started that in Sleepy Hollow and Elmsford school districts, where not only adults are learning mental health first aid, but also our young people. And then I think Matthew may touch on this, but Medicaid redesign, it really has been not successful in New York State. We're seeing young people and families having difficulties accessing case management or care management and other support services. So on the county and state level, really trying to create a more seamless ability to access services fairly quickly and effectively. So the children's system, to be quite frank, is in somewhat disarray in the state system, and there's a lot of advocacy and support that's needed to support not only children, but obviously their parents. The next slide really talks about our co-occurring system of care, and we're really fortunate to have some advocates, including, as you can see in the picture, Senator Pete Harckham and other folks who've really helped us look at how we can create a more integrated, seamless system, especially between mental health, substance misuse, and also developmental disabilities. When we talk about co-occurring competent care, it really is that complexity is the expectation, not the exception, when we work with individuals, and that all programs should have some basic knowledge about mental health and substance use, and not having the revolving door system that we're currently experiencing across the state. To be quite frank, we feel the state is quite far behind in terms of silos. What we've tried to do in the counties and also in the Mid-Hudson region is really try to bring the entire service system together, mental health, substance use, hospital, peers, and really looking at best practices, developing a competent workforce, but also looking at how we could better braid and blend funding at the local level so individuals and families are not going back and forth between systems that truly can't meet their needs. I do want to acknowledge Stephanie Marquezano from the Harris Project, who's really been a leader, and her voice has been heard loudly, not only in Westchester and New York State, but across the country. And unfortunately, she lost her young adult son due to an accidental overdose, and he struggled with both anxiety and substance misuse. So we know we can do better. We're pushing hard at the state level. We still feel that there's this idea of self-preservation at state systems, but we hope to slowly chip away and really not have different certification, different licensing, different case records, having to wait in different waiting rooms in an agency, whether you have mental health or substance misuse issues. So this is something we really need to work on, and we hope that your voice and advocacy will be heard loudly in Albany. The next slide talks a little bit about our opioid response and overdose prevention initiative, and it's really part of the opiate settlement funding. Westchester received so far up to $18 million. Right now, I still have a voided check in my office, but hopefully we can cash that in. But part of the settlement includes looking at prevention, harm reduction, co-occurring disorder, and also having peers embedded in our service system. So we have this infrastructure that includes the county departments, the district attorney's office, public safety, and other key stakeholders, including family members and advocates that are really going to help us use this money in a proactive way to create a continuum of services for our residents. And that includes young people and adults. The last couple of slides I have, and this is where NAMI has been a part of all our efforts that we've talked about, but obviously our suicide prevention task force has really been quite robust. We do lots of trainings, as you can see listed, but we also include some of NAMI's trainings, both in schools and community education. So they're part of our toolkit, and we really appreciate the work of NAMI. The picture you see there is something we started 2 years ago called Soul Shop, and it's a faith-based training that we do for faith-based leaders. And the trainer is not only a faith-based leader, but also a social worker. So there's now a national curriculum that she sort of piloted here in Westchester, and it's a full-day training where we really embed suicide prevention, mental health language within a faith-based sermon. So we have all denominations, rabbis, Catholic, Muslims, Buddhists, who are now part of an ongoing learning collaborative that Marie is very involved in, and really trying to reach those credible messengers who touch so many people's lives and can really help us in educating and connecting people to services. So we're proud because we're showcasing this curriculum now at a national level. We also have a faith affirming directorate we started, where clinicians who have shared that they're comfortable and competent in terms of bringing faith within the treatment world as well. So this is something we're really excited about. We also are only one of 3 counties that now has a suicide fatality review task force, where we're looking, unfortunately, at completed suicides, but trying to target some of our interventions. We also, as I said, have the College Learning Collaborative, where we meet with colleges on a regular basis. And we do a whole lot of work with our school districts as well, trying to build capacity. Another area where NAMI has really been leaders, along with Roy Lucille Atari, who lost their daughter, unfortunately, to suicide, is we're going to create a Garden of Remembrance where we will have a dedicated site in a Westchester Park where people can reflect, also educate people. And we're hoping to launch that September for Suicide National Awareness Month. And I want to thank Marie and others who really led this effort. And we're really excited about having this important garden to reflect and to remember and to educate people about suicide prevention. The last slide that I really want to talk about, because I know this is going to be a major issue for the state budget, is really having a mobile crisis response. And just as we have, when there's a fire, we call the fire department, police, we call the police. When there's a health issue, we call EMS. We don't have anything in behavioral health, to be quite frank. So what we've done in Westchester, using a lot of local funds, is we now have a 911 diversion initiative, which just launched 2 weeks ago. We were piloting it for a while. So whenever anyone calls 911, and we have over 46 different dispatchers around the county, they have been trained in use of an evidence-based behavioral health instrument. And if needed, after they go through the script, they will connect with our crisis network, which is St. Vincent's Hospital, where they have a 24/7 staff available. And the police doesn't disconnect and send the person to the crisis network. They actually call and speak to the person together. And then if it's a behavioral health issue that doesn't require sirens and police to go out, they will take the lead on those situations. So we've trained every 911 dispatcher, and you may have seen on 60 Minutes a few weeks ago, they had a special about Austin, Texas. It's a very similar model that we've incorporated. We've also expanded our crisis intervention team training. So as you probably know, every new recruit police officer has to go through a 40-hour intervention, and NAMI is also often part of that training. We're doing ongoing training for police officers, and not only just police, but then embedding that model within our communities. We're doing enhanced emergency medical services training. And probably the biggest thing is we've just launched through county funding 8 mobile crisis response teams that are co-located with police, and there's a co-response. So if a person calls police or somehow gets in contact with them, they will decide whether police need to go out to secure safety, whether police and a behavioral health team goes out together, or whether it doesn't really require public safety officers and our crisis teams can go out. They will be 24/7. We have 5 agencies in our county that have been selected. And I want to thank Audrey, who's on this call, who's on the selection committee. And this is really first of its kind, to be quite honest, in New York State. And we decided not to have a centralized mobile response team. We wanted it to be local and really reflect local community strengths, the residents, and really be more embedded within that community. And finally, and I'm sure Matthew will talk about it, 988, our new national suicide line, will go into effect this summer. Westchester's actually dedicated a couple of lots of money to help our St. Vincent's team become the new national suicide hotline for Westchester County. Up until about 3 weeks ago, all the calls were going to Syracuse for Westchester residents. And thanks to St. Vincent's, they now are the local national suicide line. And over the summer, they will be the 988 suicide prevention line. So we've invested a lot of local resources, thanks to our county executive and board and legislators. And what we're trying to do as a county, and that's why your advocacy, what Matthew will talk about, is how do we strengthen and sustain some of these initiatives. And it'll be through your voice. It'll be how we can effectively use the federal and state dollars and really prioritize these behavioral health services. And my last slide, because I know we really want to get into Matthew and how to advocate, is just my contact information. I'm available if you have questions, thoughts, ideas, want to be part in any of the different forums that I talked about. Please don't hesitate. We'd love to have you participate. And I want to thank NAMI for inviting me tonight. I look forward to hearing the rest of the presenters and hearing more about the discussion. So thank you.
Wow, Michael, thank you. That was a lot of information and you know it all so well, and you're just so good at sharing. Every time I talk to Michael, I learn something new. So thank you very much. Michael's an amazing leader, and we're lucky in Westchester County to have him. involved in all these different initiatives. He never says no, even, to come tonight. I'm sure he has lots of meetings to go to, and we're really appreciative that you're a part of what we do. Thank you. Next up, I'd like to welcome Matthew Shapiro, who's with NAMI New York State. He does research on the legislation and he heads up the public policy department. So Matthew, we're happy to have you.
Thank you so much, Marie. I'm so happy to be here, even though I'm not with you. I wish I was. Coming down and doing this event really is, as the commissioner said, one of the highlights of my year. Of course, I love meeting with all the fantastic Westchester advocates, but I always learn so much. Actually, you took the words right out of my mouth, Maria. I always learn so much from the commission and all the incredible things going on in Westchester. And I say this all the time to advocates, and I think in Westchester it's more true than in other places, is that sometimes when we're so in the thick of things, we lose a perspective a little bit, and don't realize sometimes that we have it better than other people. And just listening to all of this, I took a whole page of notes because Westchester really is so ahead of the curve in so many areas, and that's really such a tribute to Commissioner Orth and his team, and to you as advocates. As the commissioner said, a lot of these initiatives happen because you made your voices heard, and that's what's so important. And I'm going to touch on some of the things throughout my talk that the commissioner talked about. I wish I knew about all the great 911 diversion and your mobile crisis and your crisis response teams as NAMI was working on our 988 report we put in November. I think we are going to try to do a second version of it with really good case studies, and obviously all the fantastic work being done in Westchester is so exciting. So we can move into the slideshow, Marie, please. So welcome again. Thank you everybody for coming on a Tuesday night and taking your time to learn about these issues and how to make your voice heard. We're gonna keep it moving. I think we got a little backwards, but that's okay. Share your story, shape our future. So what is advocacy? What are we talking about here? And the commissioner already put it so well. We can move on here to the next slide, because I think the next one this kind of gives a very technical aspect of what advocacy is. But I think the next slide really drives it home. No, the next one too. Well, there we go. The fish. This is my favorite one. So again, a lot of times when you feel like a small little fish out there, a lot of times as someone who is a bit impacted by mental health issues in so many different ways, I think I've told this group, in recovery since I was 3.5 years old when I was diagnosed with ADHD. I am also a family member. My mom has borderline personality disorder. So we know how hard it can be as individuals and family members faced by these issues. And a lot of times I use that analogy. It seems like we're always running into walls. Less walls here in Westchester because there's clearly more access. But as a whole, it's so hard to advocate for yourself to get the services that you need or your loved one. But when we can come together as one, many little fish coming together create a giant voice. And that's really the power of grassroots and community organizing and what we're trying to do here and what we need you to be a part of. So we can move to the next one, please. And I really think the most important part in advocacy, and the commissioner said it too, is sharing your stories and your experiences, because I say this all the time, and there was all that technical stuff before what advocacy is. I always say the difference that separates advocates from lobbyists is lobbyists go in there with their fancy charts and their suits and what have you, their flash. We go in there with our stories. Our stories are our best tool. The facts and the figures that the lobbyists use, that may help reason people. But our stories and our experiences and putting a face on this issue, that's what moves people and moves our legislators. And again, the commissioner said it. So many of these great initiatives and really ahead of the curve initiatives are happening because people like you and Westchester residents brought to his attention. And again, kudos to him for making himself so available and so receptive. But really, our stories move, and that's what we say, that you share your story, you're really shaping our future. So I think we can go on to the next, please. And this is so important. I know I've said this to this group before because I know Rob Layton loves this quote, but this is really my advocacy motto. And I think it's more important than ever this year. And that's, if I am not me, who will be? So if I'm not standing up for myself, no one's going to stand up for me. But if I'm only for me, who am I? And that's from Rabbi Hillel. And I think that this year that quote is more important than ever. We can go to the next slide, Marie. The commissioner pointed out the struggle with the workforce, the way he said it, understaffed, underpaid, undervalued. We need to care for those who care for us. And really, again, a lot of times I think in the past, we've had a little bit of a adversarial relationship with providers because we feel like they're not doing enough for us or our loved ones, and not realizing how understaffed they are and how overburdened their caseloads are, and just how dire things have become for our industry. I mean, the commissioner said it, you can't throw enough money at the problem that a workforce can't the workforce has to be the one to deliver. I use this metaphor all the time. It's like building a building. The workforce is your foundation. Without that foundation, we have nothing to build upon. So again, as we stand up for ourselves and for access and to reimagine crisis and all these other things, we have to remember that we need to also stand up and fight for the people who are delivering those services for us, because without them, it's just impossible to get the services and support that we're envisioning. So we can go on to the next slide. So, I want to give a quick update on the governor's budget, which, in the past, I think you would have heard a very different message from me. This is actually one of the more positive budgets, certainly the most positive budget in the 14 years I've been with NAMI. And I really say it, I think this is true. And the commissioner said it too, that just many different reasons there's been an influx of money, but I think there are more positive initiatives in this one budget proposal that have been in combined the 14 years I've been with NAMI, and that's not an understatement. Let me get into this with you. So we can go into the next slide really quick. So major budget victory. So for Reimagine Crisis. So I mean, the commissioner always said all the amazing things that Westchester is doing to reimagine crisis. And you're certainly a state leader, and I would argue a national leader on this. And, we've really fought hard. NAMI New York State has become the leading voice for the appropriate implementation of 988 services. So again, it was very interesting hearing the commissioner saying that calls coming in for Westchester would go out to Syracuse. What we want to make sure is that all these calls stay in New York State. So it's 24 hours, 7 days a week, statewide coverage by in-state providers. And what's very important here is that we want all these providers to be able to provide local resources in a culturally competent and linguistically competent manner. So of course, that also takes a workforce, but that takes a lot of money. And we were very worried that maybe the funding wasn't going to be there when the governor signed a bill on 988 without the funding. But NAMI New York State has fought really hard on this. Within a day and a half, we assembled over 100 organizations, including the New York State Council of Local Mental Hygiene Leaders, because they know if it didn't get funded, it would create a terrible burden on the counties. But over 100 organizations. And then our NAMI advocates also joined the fight. We started a quorum campaign that generates emails to our elected officials. And in 4 weeks, we generated almost 4,400 emails. Let me put that into perspective for you. In 2021 alone, so during the full year of 2021, NAMI members generated just over 1,200 emails. So in a month's time, actually it was a little less than a month, we produced a quarter of the emails we produced all of last year. That just shows how important this issue is and what this means to people. I think this is one of the biggest social justice issues of our time. And the overrepresentation of people in prisons and jails is again, it's a scary figure when you look at over 60% of those incarcerated have either a mental health issue, substance use issue, or developmental disability. Again, so exciting to hear about the current treatment going on in the Westchester County Jail. It's very exciting, but we need to keep people out of jail. And most of those people who are overrepresented in the prison population, their journey there began with a call to 911, which could have been diverted with a call to 988. You know, I say it all the time, 988 is more than a number. It's really a gateway to recovery and hope, and a diversion from criminal justice. So we were very excited to see the funding amounts in this year's budget, $35 million in this fiscal year's budget. So actually, 988 doesn't get officially implemented until the end of July. So that's part of the reason for the discrepancy. It goes up in the next year's budget, almost doubles. A, because it's a full year, and B, we know that it's going to be a little underutilized in the first year. It's going to be up to organizations like NAMI to educate the public that 988 is here and we need to utilize it. We'll be doing a lot in July, well, during May and Mental Health Awareness Month, and July when it gets introduced as well, to really celebrate the implementation in 988. So that was, you know, perhaps our biggest budget victory. Next, Marie. Yeah. So the commissioner alluded to this as well. I've already talked about why we need to support the behavioral health workforce. Again, when we say behavioral health, we use that co-occurring term, people who care for those with mental health issues and with substance use issues. We would love to see those combined. As the commissioner said, we need to de-silo those. And, you know, I don't like that kind of umbrella term, behavioral health. I would rather use like an office of mental wellness, but let's not get semantics and verbiage in the way of the fact that we do need a co-occurring services. But I digress a little bit. But bottom line is these workers have really had a tough time over the last 2 years in particular, but even before the pandemic, this industry has really struggled with flat funding, and especially the nonprofit mental health workforce, you know, where the agencies have contracts with the state. They've received flat funding and their employees have received flat funding for such a long time that literally we're losing people from this industry at very scary numbers. Again, the commissioner alluded to that. So there will be a funding for a 5.4 cost of living adjustment in this budget, very encouraging. Not enough though, as the commissioner said, we have to sustain this funding, and a one-time cost of living won't be enough. Inflation's going up. It's getting more expensive to offer these services. So we're still fighting for another approximately $500 million in investments. It's a little off because we did get more housing investments than we thought. I'll get to that in a second, but we still have a lot of work to go despite this big victory of the COLA. Next, Marie. Yeah, so access issues, I alluded it to before. There's going to be over $100 million over the next 2 budget cycles for mental health housing, community residency programs, which is something NAMI New York State has advocated for a really long time. Very excited about that. Another program that NAMI has worked on for a really long time in support of is the Dwyer Veteran to Veteran program, and it got the biggest investments it ever received, $7.7 million, which should expand it across the state. You know, it was very interesting listening to the commissioner talk about children's services, both the, you know, trauma-informed care and what children need in crisis situations. And when we do have that crisis situation, I alluded to our report before. I thought there'd be a chat box where I can put links in, but that's okay. You know, in our crisis report, we actually have a section on the needs for children in a crisis, which has to be a little different than what an adult would receive in a crisis situation, because a child isn't a little adult or a miniature adult. They're a child that has unique needs. So, you know, very excited to hear about what you guys are doing here. But the budget does have significant investments in children's mental health as well. The commissioner mentioned school-based plans and more school-based initiatives, which is something we really want to see, because we know for a lot of children, their only access to mental health supports is through the school, and that's been a very successful program. Something else that we've argued for across the board is integrated care when it comes to primary care and psychiatric care. You know, if you can get that under one roof, if you know, when you go for your physical and your doctor's worried you could be depressed, if there was a therapist or a social worker across the hall that would be able to help you, well, that really expedites the process. And while we don't have the type of integration across the board, the governor in her budget really is stressing for that type of integration when it does come to pediatric care, because we know there's such a shortage of children's mental health specialists and pediatric psychiatrists. So that's a very positive initiative as well. And a lot of interesting investments in suicide prevention that truthfully I'm still learning a little bit about, so I'm not 100% comfortable talking about, but looks like there's a lot of potential there. So next, please. I know the next slide is, yes. So now we've had all these major victories, the best budget that we've had in years. Why am I still talking to you today? Why am I just patting myself on the back? We've done a great job of communicating our message. The governor listened. Hopefully we'll get fund, you know, this funding looks like it's going to go in place. Well, first of all, nothing is guaranteed. That, you know, we still need to get all these funding proposals through the legislature. But I point to one of my advocacy heroes right here, and one of my favorite movies, Mr. Andy Dufresne. And I don't know if anyone else has seen The Shawshank Redemption or read the book. Both one of my favorites. I think it's one of the few movies that lives up to the book. If doesn't, it might even be a little better. Neither here nor there for our arguments. But my favorite scene in Shawshank Redemption, a lot of people love the end, and you know, the end is great, but my favorite scene comes in the middle, when, you know, Andy Dufresne's in charge of the prison library, and every week he sends a letter to the state legislature asking for funding for books so they can expand the library. One day the warden calls him into the office, and there's these boxes and boxes and boxes of books. And the warden turns to Andy and goes, well, I guess you can stop sending a letter a week now. And he goes, you're right. Now we start sending two. And that's the heart of advocacy, that we're never satisfied with what we have, especially for people, you know, who've been experiencing mental health issues. We've always gotten crumbs, even in the best of budgets. You know, last year, there was the biggest budget in New York State history, the most revenue and the most spending. And we didn't see those type of mental health investments in mental health, not even close. So while this is certainly something to celebrate, this is something that should have happened a long time ago, number one, and it's still not enough. I mean, the commissioner pointed it out himself. We need to do more for our workforce. We need to create more services so we can increase access. We talked about increasing access. Well, we can't increase access without the actual services being there. We also have a couple other initiatives. I think we can go on to the next slide. Yeah, I kind of already explained this, so I can incorporate, so we can go into this. We know about, access. So a couple things, we can stop here. We can go back to one. A couple other things that we are excited about. I did want to mention this. So this just got introduced last week, something we're very excited about. We joined our mental health chair in the Senate, Senator Samra Baruch from Rochester. She just introduced a really exciting package of bills to address maternal mental health issues. These are issues that don't get talked about enough. You know, hats off to our board president, Mary Bartlett, who participated in the press conference and discussed how she had postpartum depression after the birth of both of her children, and why these issues are so important. So together, these bills would address disparities in care, increase prenatal and postnatal care, and improve postpartum depression screening tools. So we're very excited to support the senator and really open up the discussion on maternal mental health, which, you know, we will talk about how mental health issues are stigmatized as a whole, but these are much more stigmatized. A lot of times women and young mothers suffer in shame because they're embarrassed to talk about these issues, and they feel it's like a failure as a mother. So taking these issues out of the dark and supporting women and supporting young mothers and supporting their children as well is so important. So I do want to mention that, something we're very excited about. We're also, I think there was a slide in there, we might have skipped over, but we're also really pushing hard for the mental health access bill. It's 83276 in the Assembly, which would really, it would be a game changer. Don't worry about it, Marie, it's fine. It would, it would regulate what we call step therapy or fail first practices when it comes to psychiatric medication. So what fail first and step up is if your doctor provides you a medication, your insurance may not want to cover that medication. And I'm not saying cover a generic version of the same medication. They want to put you on a totally different medication for, let's say, bipolar disorder. But we know, we really believe in person-centered care as the driver of recovery, and making sure people get the medicine that's right for their individual recovery is so important. And this is such a great bill for us because it would regulate those practices. And it's something actually that Assemblywoman Gunther, our mental health chair, introduced last year. But it was our advocates from NAMI Queens Nassau. They had a meeting with Senator Todd Kaminsky. They mentioned the Assembly bill. He got it introduced in the Senate, and 6 weeks later, it passed the Senate. So it really, again, shows the power of NAMI's voice that we got this done. And now we have to make sure that the Assembly follows suit and really prioritizes people over insurance plans. So we still have a lot to fight for all, despite all our successes and despite the fact that we had certainly a very positive budget, we need to make sure everything gets to the finish line and that all these positive initiatives make it to the end. So, again, we need to fight harder than ever before. And if we do, and if we're successful, we'll really have the most impactful year that we've ever had. And again, the greatest tool that we have in this fight is our stories. I said it before, I'll say it again. Share your story, shape our future. The other way, I really like to talk about this. If you were at our state conference a couple of years ago, we had Maura Ronaldo, our leader of mental health awareness, who's the voice of Showtime Boxing, and had a documentary, Bipolar Rock and Roller, made about him. And the tagline of the film was, voice the fight. And that's what we do. That's what we voice the fight. There are tips for how to effectively tell the story. I will share the NAMI Smarts Telling Your Story kit. If you've already registered for our NAMI New York State Action Weeks that are taking place over the next 6 weeks, you should have received an email today. We have 2 NAMI Smarts trainings coming up over the next couple of weeks that are open to all participants. You just have to register for them. And that will teach you how to most effectively tell your story. But I'm always a big show, don't tell people how to do things. So instead of telling people how to tell your story, we're really lucky, and you and NAMI Westchester are really lucky to be joined and have amongst your midst 2 of the best storytellers I know when it comes to storytelling as advocacy. So both of them also serve on the NAMI New York State Board, and I've gotten to do many advocacy meetings and events with them. So, again, they're such a great example of how to do this and be effective storytellers. So first I'll introduce my good friend, Julie LeClaire-Netjes, to tell her story. And then we'll hear from, I know Julie is the Westchester Government Affairs Chair. I know that we have Marty Gromulet, who's the New York State Government Affairs Chair, and Julie's also on our Government Affairs Board too. So you have two true leaders here. So I turn it over to them.
Okay, great. And thank you. And also Marty co-chairs with me. So Marty's got lots of hats, just to say. So anyway, I'm very happy to meet you all. And my name, as he said, is Julie LeClaire-Netjes. And I am on the board of NAMI New York State and NAMI Westchester. And I actually wear 2 hats. I'm a clinical psychologist, so I actually provide services, but I'm also a mother of a daughter with bipolar disorder who has bipolar disorder, and I'm going to talk about her. So I'm going to put on the hat of a mother, and I'm going to talk about 2 legislative issues that my daughter illustrates. But first, I'll introduce you to her. Her name is Alex, and tragically, she did pass away at age 25. She was a freshman at Dartmouth when she was diagnosed with bipolar disorder. And what happened is she actually did get stigmatized while she was there because she emailed her entire class from the psychiatric unit. And so then she transferred to NYU. And she herself advocated, and NYU actually posthumously gave her a college degree, which was a very beautiful thing that they did for her. And also my daughter, it was amazing, but at her funeral, a bunch of people who she inspired, even when she was manic on the psychiatric wards, came to her funeral. And one person who couldn't make it to her funeral flew in from California, and that person read a 7-page letter at my daughter's gravesite and said she was going to name her first child after my daughter. And so I am going to tell you about the 2 issues. So one has to do with Nicole's Law, and we are advocating very strongly for that so that people, when they get discharged, will get the proper care and not be left at risk for suicide. And in my daughter's case, when she got discharged from the psychiatric unit, she was put in a residential setting, but then she waited weeks and weeks to get treatment. And she went from a manic episode straight into depression, and the residential treatment center didn't understand. They just thought she wasn't being cooperative. And unfortunately, my daughter had a very severe suicide attempt. She ended up on a ventilator in a hospital. If her roommate hadn't come back, my daughter did it while everybody was at a Mets game. And if they had stayed extra innings, my daughter wouldn't have made it, but her roommate found her. And my daughter did survive that attempt. But had we had Nicole's Law in place, then she wouldn't have been waiting for weeks. People would be able to get the proper care when they get discharged, especially, for those who are at risk for suicide. And that is one of the asks that we really hope we can count on you to support Nicole's Law. And the other thing I'm going to talk about is that my daughter also, she crosses a number of issues, but I'm just going to talk about 2, is she also illustrates Daniel's Law, which is that we are advocating for people to have a mental health response to a mental health issue. And when my daughter was transferred to NYU, she had a manic episode in New York City. A door slammed in a bar, and the door cost more than $250. And they could tell that my daughter was not mentally doing well. But in any case, they called the police, a SWAT team arrived, not a mental health response at all. She was charged as a felon since the glass cost more than $250. She was put in a hospital psychiatric unit with murderers from Rikers Island. It was a special prison unit where she never would have ended up had there been a mental health crisis response. She would have just gotten help. And so that is another ask as well, that we really hope that you can help us with Daniel's Law. And that, of course, ties as well into the 988 response, which would have gotten her a mental health response versus a SWAT team. And even the police, had they had the crisis intervention training, I'll put in something else we support, then they might have handled this hopefully in a much better way. So anyway, I am giving my daughter a voice because she herself used her voice when she was alive. And I thank you for listening. And I really hope you will support both Daniel's Law and Nicole's Law. And thank you for listening.
Thank you so much, Julie. I've heard you tell this story so many times, and I'm always moved. And, I feel like I know Alex through the story, hearing it so many times, but I'm always so moved. And before we tell Marty's story, I know, Julie's story also touched on Daniel's Law. We talked about crisis services, and when we have this discussion, I just want to be very clear about something. We're not trying to vilify the police here at all, especially in Westchester, when you're so progressive. Every cop is going through CIT. You have national leaders like Mark Giuliano leading the way to better crisis response. But it's not police job to respond to these issues. The commissioner said it so well. When there's a fire, you send the fire department. When there's a crime, you send the police. You wouldn't send the police in just to put out a fire. They may be so well-intentioned, they may want to put out the fire, but they don't have the skills to put out the fire. It's not their job. So that's, again, when we have all these discussions, especially when we hear Marty's story, again, this is a story of things that went wrong and things that we want to fix. But, we do have partners in the police too. And when we have this discussion, I don't see it as NAMI New York State doesn't see it as a defund the police issue or trying to paint the police as the bad guys in this situation. It's a bad system. As the commissioner said, there just has no one ever thought to have that same type of response as you would get for a fire or as you get for a crime. So the police are kind of filling that gap, and sometimes, most of them are doing the best they can on this, but it's not the job that they were designed to do, and that's why we need to do better. So I just wanted to point that out too. It's so important, especially in Westchester, where you're really leading the way on crisis response and have such a great trained police force. But that took time, and one of the reasons you needed all that training is stories like the one we're about to hear from Marty. So I turn the floor over to you, my friend.
Yes, thank you, Matt. Thank you for that. So I think most people know me. I'm Marty. I'm on the NAMI New York State and Westchester boards. And Matt, you sort of glossed over like this historic achievement you achieved, like, right? You got a $60 million, right? OMH took what you wrote and copy and pasted it, right, in the governor's budget. I just, maybe you could, expand on that a little bit more, but this is, right, NAMI New York State, NAMI National is looking at New York State for what to do in other states. So I just want to thank you for the hard work and let folks know, like, this is, you've put a lot of work into this.
I'm gonna have to hire you as my PR person too, I'll tell you. But thank you, and we did. It's not me. It was everybody. Again, we talked about over 4,000 emails getting generated in a short period of time, and we really mobilized our voice. It's been an honor to lead that fight, but it's really hearing stories like yours that really brought home to me why this is the most important issue of our time. So my hat's off to you, my friend.
Thank you. And I'm cognizant of time, and I want to leave time for questions. I think, advocacy is huge, very important. But I wanted to thank Michael Orth. The county sounds like they're working on so many exciting programs. I'm so happy to hear that the DA believes in mental health. That is huge. Hopefully some of the judges do too. I believe the county has a mental health court, right? Diversion court. I think we need to publicize that more. We need to advocate for that more. I wish I was able to go to mental health court when I got sick. So thank you, Michael. And, recognizing, do we have the infrastructure when 988 hits? And I think it's wonderful you did this 911 diversion. Can that be used as a model for, when July comes around and we need these crisis teams? It's wonderful St. Vincent can be a model for the state. Do we have the infrastructure in Westchester, right, for only one crisis team? Because Westchester is a big county. So those are just some of the thoughts that come to mind. But thank you both. And let's advocate. Let's get this done. Thank you, Matthew.
Oh, thank you. And I know we are over a little bit over time. And that's one of those. There is a bill too that we have, and there ain't really get to go into all of our legislative terms. But if you go on our website, we do have listings of everything there, all the bills that we're supporting, an updated action agenda. But then one of those bills would be to create more diversion courts, and that's actually from Senator Reichen Melnick, which I think he touches a little bit on Westchester too. I know it's mostly Rockland, but he has introduced that bill as well. So I do want to open up if anyone has any questions about any of the issues. I know I kind of glossed over a lot really quickly. I'm happy to answer any questions or explain something further. So open it up.
So if anyone wants to ask a question, you can just unmute yourself and take turns.
I have a question, Matt. Are there particular bills that you need us to advocate for or call our state assembly or senator about?
Yeah, so thank you, Audrey. There are. And what we're doing, we actually just launched another campaign today, like we did for the 988 funding around the A276, the mental health access bill. We really want to see that pass. we've passed versions of that were a lot broader, that would have handled, addressed all step therapy and fail first procedures. We got past both houses, and Governor Cuomo at the time vetoed it. So there was another bill that was a little similar that would have addressed what we call non-medical switching, which is when they switch a medication within the contract year. We had also passed similar legislation on that, and Governor Cuomo vetoed it. We passed that legislation again last year, and Governor Hochul signed it, even though it was actually Governor Cuomo was still in office when the bill passed. It was Governor Hochul who called the bill up and signed it. So we're very optimistic that if we get it through the legislature, that the governor will sign it this time. And this would help so many people. So yeah, this is our action agenda. It has all the bills on it. You can go right on our website. If you go to NAMINewYorkState.org and go to the advocacy section, it'll be right there. We're actually going to put an updated one on there. The maternal mental health package that I mentioned isn't on there, and it isn't actually reflective of the budget. So there is an updated one. It just has to be added to the website. But yeah, so as bills that we are really prioritizing and need action on right away, we are going to be using that quorum software. And again, if you've already registered for our legislative action weeks, you will have gotten a notice today about the new campaign. I'll be sending out an action alert tomorrow, and it'll be in the e-news on Thursday as well. So thank you for that question. And there'll be other bills that come up. But right now, addressing those fail first and really making sure people get the medication that they need as quickly and as efficiently as possible is really a big priority for us legislative bill-wise.
And
Thanks
you
so
all have,
much.
you all have access to that legislative action agenda that I just shared. What I just did was click through the link that I sent out to all of you with this Zoom link. That link to the document is in that same email. So if you just go back to the email where you found it.
And Marie, if
What's that?
you can get, I don't know if you can give me a list of the emails of everyone who registered. I'd also be happy to send them the direct link to send a letter to your assembly person for the 823276. Oh, my
Yep,
office.
okay. And I'm happy to, at the end, I just have a couple slides here showing how to get involved. So maybe I'll just show that now. Here it is. Okay, so on our website, our main website, NAMIWestchester.org, you'll see this red circle that I circled around. It doesn't look like that on the website. It just shows it here. That's the link where you can click to join or renew so that you can become a NAMI Westchester member. NAMI and all NAMI affiliates are membership organization. So the number of members that we have is important because it gives us voice when we do go to advocate. We can say X number of members really support this legislation, so please help us. So it's important to join and renew. And there are a few different levels. There's no pressure on, it's not about money, it's about, we are a membership organization, so that helps. So you'll see right there, there's the website. And if you need help taking care of it, just call the office. And then after that, send me an email. My name and an email address is right there. Just say in the email, very simple, you can just call it advocacy. Indicate that you'd like to join the NAMI Westchester advocacy team and participating in the upcoming meetings with legislators. And you'll get the information like Matthew just said, and the updated document that I linked to earlier, but I'll give you the updated information. And you'll receive a welcome message and related information. So there will be meetings coming up with legislators. They've already started to be scheduled, and this is the way to go about joining those meetings. So send me the email and then you'll get the information directly. And we have two great advocacy committee co-chairs that you've met tonight, Julie and Marty, and we have some other board members on here. Maybe you could just put a little, raise your hand if you're here. Our board president, Louise, is here. I think her name shows Marie, but her name is Louise. Hi, Louise. She's our president. Stephanie is on our board, Audrey, Allison, Julie, And whoops, everybody just shifted. Am I missing anyone?
Marty again.
Well, yes, yes.
Right.
Marty and Julie.
Yeah.
I didn't change my name. I'm at the office and it's registered under my nurse.
That's okay. That's okay. We're happy everyone's here. So thank you. Does anyone
You
have any
know,
more questions?
Introduction.
Right, right. Well, that's okay. You might think of other questions you might have.
I have a question. I have a question. My name is Reevadine Sacco, and I have a question on the FaithNet Soul Shop you were talking about. Or the gentleman before, Michael Orth,
Yeah, the commissioner had
the
mentioned that.
commissioner, Michael, is he still here?
Yes, I am.
You are. Okay. You know, the FaithNet that you were talking about, Soul Shop.
Yep.
I just want to know a little bit about, like, how can we be an advocate for that and be able to, like, maybe share our story, how our faith really helped us survive mental health?
Absolutely. And Marie, I don't know if you guys are connected because Marie is one of our leaders in our efforts. I'm happy to share more information, give you a description. So what you can contact me directly or contact Marie and we can make that connection.
Okay.
I'll just also encourage everyone to take a look or a brand new look, if you haven't looked in a while, at our website, because we just launched it. Well, actually, not just, it's January again. So it's been a year. Feels short but long at the same time. So if you poke around our website, it's really chock full of information. This, if you go over here to support and education, that's where all these drop downs are. So I just clicked on FaithNet. And then it gives some information about the FaithNet program. FaithNet is a NAMI word. It's like family to family and ending the silence. It's one of our programs. And it's where people share their personal journey to recovery with a mental health diagnosis if their faith was involved and was part of their journey. So we have done a couple of these presentations to leaders of houses of worship in the county through this Soul Shop initiative that Michael talked about. So it's really an amazing group. Very diverse, and it's so great to come together. There are pastors, there are rabbis, all types of people from different backgrounds. And again, talk about learning so much from one another and having respect for each other's faiths and where they're coming from is really a great place to be. It's a good meeting point. So poke around on our website, but also give me a call. We always need presenters, to get the word out. I think Sharon McCarthy was on earlier, but I think she's off now. She's our program coordinator and she schedules those presentations. But there's really a lot of information here, especially under the support and education tab. You can really find out a lot of information about the programs that we have going on. And always just call. We have the helpline, 914-592-5458. Our hours are expanded. They're 9 to 3 now. Terry is on here. Is Terry still here? Terry was on earlier. She answers our helpline. Sharon Masiavecchio is our Director of Development, and she's on too. So
kudos
just
to
call the
you,
office
Marie,
anytime.
for pulling up all that information on the fly like that. The action agenda, the FaithNet, you're really on top of it.
Thanks. Well, you did the hard work. You and Michael. So thank you. Okay, if you think of any questions, you know how to get in touch with us, and I can put you in touch with the right people to get the answers. So thank you to
And I should
everyone
mention
tonight.
too, just really quick, that again, if you register again for the advocacy weeks, you can go right online. Next Wednesday, excuse me, we're having two, one in the afternoon, one in the evening, just question and answer sessions. So if people do have questions over then, please, you don't have to register for it. We're going to send out Zoom links. It's just going to be an open discussion where you can ask about issues, how to advocate, questions about meeting with a legislator, if you want to practice your story. It's really an open forum to make people feel as comfortable as possible in this process. So just a little pitch for that as well. As I mentioned that we have a NAMI training, NAMI Smarts training coming up Monday night, and then February 8th as well. So you can go on and sign up for our action weeks, and we'll send you all the information.
Great. And you'll get, I'll have it too, and I can feed it out. So feel free to call if you don't have that information. So thank you all for coming. Have a great night.
Right. Thank you,
Thank you.
Matthew, Michael, Marie,
you.
Marty,
You too.
everybody else. Thank you.
Thank you.
Thank you.
Oh, thank you.
Thank you.